I need to apologize. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 292, and today I need to say that I am deeply sorry about something. But before I get into today's video, guys, do me a huge favor, click the like button, it really helps out this channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well, it's greatly appreciated. Alright, so I need to share a story with you guys. So, about a year or two ago, I actually worked with a PR company, and this company was based out of Florida. They were extremely expensive, and honestly, they didn't do that good of a job because, you know, I'm fairly well known across the United States and really across the world. I often get invited to go do speaking engagements overseas, which means that people who live in different countries are watching my video content. And that's all great, and I love it. The problem is that here in the greater Phoenix area, I don't have the same type of presence. I mean, when people think of like where the best place to go in the valley is, they often think of Mayo Clinic, or they think of some other clinic that's been here for decades at this point. And honestly, there's nothing really wrong with that, but I wanted to find a PR company here in the greater Phoenix area that I could work with to try to get our name out there a little bit more so people could know that we treat hearing loss at a really high level inside of our Applied Hearing Solutions clinic. So Ashley did some research, and she reached out to a marketing and PR company here in the Phoenix area, and we ended up having a conversation with the owner of this firm on Friday, just a couple days ago. And essentially, they wanted to know like what we're all about. So I kind of went into explaining like, hey, listen, everything's about hearing loss and tinnitus. I'm a big proponent of best practices, and that's kind of the differentiator of patients coming to our clinic, is that they know that they're going to experience a really high level of care because we do all of the best practice procedures and do it with a high level of precision. And after I got done explaining this, the gentleman that we were talking to started explaining to me how he's been struggling with hearing loss and tinnitus for a number of years at this point. And what he did is he went into his ENT, he told his ENT about his hearing difficulties and his tinnitus. He sent him over to the audiologist who worked with the clinic essentially, took a 10-minute hearing test, and then explained nothing about the results and basically said, hey, you need this $10,000 pair of hearing aids. Naturally, he looked at the price of the hearing aids, and based off of virtually no information other than the recommendation from the hearing care professional, he's like, you know what, I need to just think about it. A 15-minute evaluation, no explanation of the results, no counseling, no education, and a recommendation of a $10,000 pair of hearing aids. The worst part is, this was over 2 years ago, and this individual still has done nothing. You know why? Because he believes that every other place that treats hearing loss and tinnitus would do the exact same thing. Essentially, this is what our profession has come to. A lot of places try to spend as little time with you as possible, and they provide you with completely shitty care. And this is how it's pretty much done everywhere at this point. Now, there are small pockets of clinics in certain locations that do hearing care really, really well, but it's very hard to find these clinics. But this is exactly why I started the HearingUp Network. It's a network of vetted hearing care professionals that are committed to following comprehensive best practices and doing it with a person-centered care approach, not a medical model approach. This problem has been going on for way too long, and I'm trying to do anything that I can possibly do to make sure that you have a good place to go for hearing care and for tinnitus care. So if you are also sick of the same crappy level of care that exists out there in the world of hearing treatment, do yourself a favor and go to my website hearingup.com and find a HearingUp Network member in your area. And from the bottom of my heart, I apologize for everyone inside of my profession that does not provide you with an extremely high level of care, because you deserve it. That being said, I want to know what your experience has been. When you go into a hearing care professional, do they do a really good job with you, do a really comprehensive test, explain your test results, give you a recommendation and why they're giving you that recommendation, or do they give you the same crappy level of care that this individual got from the ENT clinic that he went to? Let me know in the comment section.